You would have held discussions with them. So we are seeking to attract these investments so we can also export medical services. I'm also pleased to announce that we closed the sale of the cancer center yesterday for $13 million. And the
13?
entity,
13.
30 million easy.
Down from 40 now.
No, it was
What
always
was the
13.
Prime Minister?
It
30
was
as in
always
30?
I think he's at
13, 1-3.
1-3. Oh,
Well,
okay.
we acquired the building, not the equipment. And the valuation of the building was 13 million.
1-3.
1-3.
Yeah.
There is an entity out of North America that is involved in the health space. They have a number of novel cancer treatments, and they will be providing the service here. In addition, they have some products too that they'll be exporting within the region from Antigua and Barbuda. And that cancer center now is likely to become an export product to the Caribbean region. Even Joy John has built out a hospital at a cost of over $40 million, and he too expect to provide services certainly within the Northeastern Caribbean and beyond. You would know, for example, for the last several years, we have developed a very active stem cells industry. Every month, we have dozens of North Americans traveling here to get treated with stem cells.
Yeah, actually.
Sorry.
Yeah, Prime Minister, I am happy that you got to that point about the cancer center, because that was going to be something I was going to ask later on in the discussion. Now, we all know cancer is a very debilitating disease. And from what I'm understanding, it's a private entity that would have bought the cancer center.
Correct.
Is there any carve-out for locals?
Yes,
You know,
in
for
fact,
cancer
we have
treatment?
capped their treatment for locals, I think, at about 12,000 or 13,000 US. Prior to that, it was about 10, but we had to subsidize utilities and other services. So when you netted out the subsidy that they got for utilities, we were probably paying about 12,000 US dollars per head for the previous individuals who were treated at the old cancer facility. And considering that you'll be getting novel treatments as well, beyond the usual radiation and so on, we agreed to an additional 1,000 US dollars, which the government will pay on behalf of Antiguans and Barbudans. So we expect very shortly that the cancer center will be reopened under new ownership. It was always private, even though the government had a small equity stake of about 20%, but it was majority
So
private.
the cost of treatment will be subsidized then?
It has always been and will
Okay.
continue to subsidize the treatments. But we expect that the exportation of their services will bring significant income. So at the end of the day, the government will be in a better position, even though we're paying an increase per patient based on the export potential of this product or the services rather that they'll be providing. We're pretty sure that we'll be in a better economic position going forward. So I was speaking about the diversification that is taking place. I mean, even in areas of technology, blockchain technology, and so on. We're not very big in the crypto space, but where we have entities that are well vested with assets that involve or wish to involve in that space, and they have backing assets for whatever cryptocurrency they're floating, we'll engage them. We're very conservative. In fact, the reason too why we didn't end up with any issue with FTX is because we are very conservative. They came here for us to be registered. In fact, at one point, Bankman-Fried asked me to come to the Bahamas to meet with him. I did. But we didn't quite understand his model. And we didn't understand the model,